As the third video in this series, I'd like to talk about blood flow to the leg and back, or in the case of sharks, the pelvic fin. There will be more on blood flow to the digestive system, but that would perhaps be best left to the chapter on the digestive system. Once again, I'm not going to repeat the information about blood flow to the gills to become oxygenated from the previous two videos. And so from the gills, these efferent arteries bring blood to a dorsal aorta, which will then, so here you see the efferent arteries emptying into a dorsal aorta in the shark. There's the dorsal aorta, which will then carry oxygenated blood to the caudal end of the shark. So branches will go off to the digestive system, can be covered later, to the tail, but I'd like to talk about the pelvic fin. That being special because no jawless fish, not even any known in the fossil record, are known to have had pelvic fins. And so it would be the jawed vertebrates, such as sharks, which would have a pelvic fin, where arteries would service those muscles, veins would return it. And then there are lateral abdominal veins, which would return blood from the fin. So from the dorsal aorta and iliac artery, we use the same terminology for the artery in the region of the hip in humans, one of the hip bones being the ilium. So the iliac artery then reaches the pelvic fin. There are capillaries, and the iliac vein returns it to the lateral abdominal vein, which will then enter the cardinal vein system, which once again are veins which fish have, but also are even present in human embryos. And so in addition to pectoral fins, which are present in some fossil jawless fish, jawed fish have pelvic fins as well. And so there are arteries which service them. If we were to then consider the frog, we see something similar, but we do have to begin just a new topic, and that is the definition of a portal vein. Most circulatory routes go something like this. From the ventricle of the heart, there is an artery that then goes to a capillary bed that then drains into a vein that returns to the heart. So artery, capillary, vein. There are several places in the body where the route goes artery, capillary, portal vein, capillary, vein, back to heart. So that there is a portal vein between two capillary beds. That's why it's called a portal vein. There is a big one in the digestive system, which once again will be considered with the blood vessels of the digestive system. And humans have this as well. There's a hepatic portal vein. There's a small portal vein which connects the hypothalamus and the pituitary in a human. So humans have two portal systems. But when we go to the frog, we see a third portal system, which many vertebrates have, a renal portal system, which I'm going to have to describe. So once oxygenated blood is in the ventricle, it then goes through the arch of the aorta. Now, once again, there are two arches of the aorta because these are derived from the third aortic arches. Embryologically, they form on either side. Frogs retain both, and then they fuse to make this one single dorsal aorta, which then proceeds towards the legs. Once again, humans will only keep the left arch of the aorta, birds the right. So the dorsal aorta then reaches the legs, and the region of the ilium of the hip, we have what's called an iliac artery that then goes to the thigh, where we call it the femoral artery. And then, there will obviously be arteries going to the lower leg as well. I'll just stop there. Just say leg capillaries in general. This is not, even though it's called the iliac artery, the femoral artery, a tibial artery, these aren't separate arteries. We just take this one road, and give it different names at different points of its route, depending on what bones are nearby. The deoxygenated blood then comes back the femoral vein, the iliac vein. And now here you will see there are two options. We often see that there can be alternate venous routes back. So when I said send blood to my foot, the blood can come back through the tibial vein to the popliteal vein to the femoral vein, or it could come back the saphenous vein to the femoral vein. So from the same destination, there can be two routes back. And here we see the same. There is a ventral abdominal vein, okay, which will then go reach the liver, form the hepatic vein, and that can then empty into the sinus venosus. So that's one route back. But then here's a second one. In the frog, as we will see later, the kidneys are located here. Some of the blood from the leg, not all of it, but some of it, then enters what's called a renal portal vein. It's called a portal vein because it then forms capillaries in the kidneys. This is where nitrogenous wastes are filtered out. So there are capillaries here. From the capillaries, we form renal veins, which then form an inferior vena cava. Let me emphasize, an inferior vena cava. Fish don't have this. Fish can have cardinal veins, which return blood from the caudal part of the body. But it's only the tetrapods which have a post cava or an inferior vena cava. So this is a new blood vessel formed in the tetrapods, which then empties into the sinus venosus. And so here, once again, we see those two systemic arches forming the dorsal aorta. Okay, and then the dorsal aorta will then form iliac arteries, which go to the leg. From the leg, so here the legs here to the left. So that's one leg over here. That's another leg over here. Here's the dorsal aorta splitting into the iliac arteries, which will go to each leg. Coming back, there are veins coming from the legs, iliac veins. Now, some of this blood can come back as ventral abdominal veins, I'm sorry, a ventral abdominal vein. But we also see that there are, from the iliac region, a renal portal vein, which goes here to the kidneys. So this is blood from the legs. It then goes to the kidneys, forms capillaries here before multiple renal veins empty into the post cava, or the inferior vena cava. Okay, so there are two routes back. This ventral abdominal vein, which will then go to the liver, or the renal portal vein to the kidneys, to the renal veins, to the post cava or the inferior vena cava. So once again, from the leg, we have the femoral artery and vein going to the iliac artery and vein. Note that the ventral abdominal vein coming from the legs, that would be off to the right, then enters the liver. Here, once again, you can see that ventral abdominal vein. Note its junction in the liver. And so we have these two alternate routes back. So the second route is from the renal portal vein into the kidneys, where it forms capillaries. You can see all the blood flow there in the kidneys. From there, we form renal veins, which empty into the inferior vena cava. So this renal portal system, that's something which is typical of many tetrapods, but is not possessed in humans. I've already covered in previous videos how salamanders will send blood to their lungs and or their skin, and the lungs are these elongate structures which stretch in this region here, and from there the dorsal aorta, all right, can then carry blood to the iliac arteries, to the femoral arteries, and then, the leg can have, separate subdivisions. There are salamanders whose legs are much reduced. There are salamanders which are 4 feet long, and so, the arteries of the leg can vary. There are capillaries in the leg, then the femoral vein can then form an iliac vein. And now there are two alternate routes back. Posterior cardinal veins into cardinal veins, this is a retention of the veins which are present in fish, and human embryos have cardinal veins, or once again, a renal portal system going to the renal veins. And so here is the dorsal aorta, and on either side of it, you can find cardinal veins, just as you would in the shark. And so that's a retention of the ancestral fish characteristics. After the renal portal system, just as in frogs, there is an inferior vena cava or a post cava. Once again, no fish has that. That was a tetrapod development that then goes through the liver. There's a hepatic sinus. You can see this very wide area, which is thin-walled, before the hepatic sinus empties into the sinus venosus. Here, so from the leg, blood can go to the kidneys. From the kidneys, renal veins can empty into the post cava. If we were to then look at the turtle, I'll just go through this quickly because the major points have been covered. Once again, we would see very similar pattern, so that from the two aortic arches, which once again would fuse, we get a dorsal aorta. So from the ventricle, notice there's kind of this heart-shaped loop where the two aortic arches then fuse to make a dorsal aorta. From there, in the region of the ilium, that's the ilium bone there, there's a common iliac, an external iliac artery, which goes to the leg, femoral arteries, and then, there can be multiple arteries branching in the leg. We then get to the capillaries where gas exchange occurs. There's a femoral vein which returns, an iliac vein. And notice now that all of the blood from the leg is now coming back into this renal portal vein. The kidneys would be here. All right, so we've lost, those cardinal veins or ventral abdominal vein we saw in the amphibians. And then after passing through the kidney, through renal veins, the renal veins would empty into the inferior vena cava or post cava, which then goes to the sinus venosus. And so there are other veins as well draining other parts of the body, like lateral, abdominal veins, but the blood from the legs passes through the kidneys through that renal portal system. Avian circulation. Very quickly, once again, the birds have the advantage of completely separating the oxygenated and deoxygenated blood in their ventricles because of the complete split. While in mammals, the only aortic arch kept is at the left side, the left arch, whereas in birds it's on the right. That then forms a dorsal aorta, which then in the region of the hip and the ilium forms an external iliac artery to a femoral artery. There's various branches of blood vessels in the leg, and then a femoral vein to an external iliac vein to the common iliac vein to the inferior vena cava. There is no longer a renal portal system here in birds, and mammals have lost it as well. And so when we consider then the circulation from the legs coming from the opossum or the cat or the human, the iliac, the common iliac vein empties directly into the inferior vena cava, which will then run to the right atrium of the heart. So the inferior vena cava is going to empty into the right atrium, and it does not pass through the kidneys. So there is no renal portal system in mammals, and the same would then be evident in the cat in the next video or in humans. Now, once again, I'll mention in humans in a second, there can be, additional blood vessels. I've just said, blood vessels in the leg. So here, just in a cat, is the descending aorta, which we could split into thoracic aorta in the thorax and abdominal aorta if we want. And then it branches to make an external iliac. Humans will have a common iliac artery, but not cats. So the external iliac arteries will go to the legs, and from there then form a femoral artery. Now the femoral artery will then dive through adductor muscles, go behind the knee, as the popliteal artery and vein, which then goes to the tibial artery and vein in the lower leg. On the way back, you could travel the same route, but you can also have a superficial vein coming back. So you can have a deep vein, the tibial vein, the popliteal vein to the femoral vein, but you can also then have an alternate route back as the great saphenous vein that does not go through that adductor muscle and is very superficial. In humans, we would see, pretty much the same setup. The only difference in humans is that the abdominal aorta will form common iliac arteries. And from the common iliac artery, you would have both the external iliac artery, which would then go to the leg, and also internal iliac arteries, which go to the organs of the pelvic cavity. And so, being derived from the blood vessels of the jawed fishes, which then develop blood vessels from the pelvic fin. The tetrapods have just lengthened these to service the leg, and in earlier tetrapods, there was a renal portal system where blood could then pass through the kidneys on the way back. In mammals, there are separate arteries which send blood to the kidneys and separate veins which return it to the inferior vena cava. So blood from the legs does not pass through the kidneys. And just as I saw in the cat, in addition to the deep vein from, say, the tibial vein to the popliteal vein to the femoral vein, there is a superficial vein, the great saphenous vein, which can return deoxygenated blood to the inferior vena cava.